Okay, we'll go ahead and get rolling here. Well, again, thank you for joining us today. My name is Jennifer Zodi. I am the Senior Manager of our Patient Services Division at Mountain Pacific. And we have partnered with the state for many years on many different contracts. And this is a new piece of work that we are going to be starting at the request of what used to be the AMDD division. And so we have been working closely with them to get this transitioned. Today on the call, I also have Lynn Morrison with us, and she is our utilization review supervisor. So it will be her and her team that will be handling these requests. So today, what we're going to focus on is I'll give a brief overview of Qualitrac. We will go through how to submit an SDMI waiver request in Qualitrac, and then we'll also show you how you can view request statuses and outcomes. And then I will pull up our portal page that we'll be referring to frequently, and just showing you a real quick walkthrough kind of live demo of that. So what is Qualitrac? Qualitrac is our web-based health management system. It was built and is maintained by a team of clinicians and technical experts. We actually contract with a company called Telligin this is their portal, and so we contract with them, and some of you may be familiar with them. We also subcontract with them to do some of the behavioral health work that is in our contract with the state of Montana. And so we started working with them even before we took on some of the behavioral health work, and started transitioning some of our other contracts into the Qualitrac system back in April of 2019. So while it's new to you guys, it is definitely not new to us. And we have really enjoyed using it. Some of the benefits of it is it provides 24/7 provider access. It really helps streamline the review process. So all of that necessary information is contained in one page on one page. It's a secure electronic upload of clinical documentation. We used to do a lot of faxing, and as I'm sure you guys are all aware, faxing is not ideal. I always say, I wonder what happens to some of these things that go into fax land. So it's really nice because it's secure uploading. So again, it's all right there, and we can see things that are submitted to us instantaneously. And then it allows the provider the ability to kind of track the progress of those submitted requests. So you're not having to call and say, hey, I sent this, did you get it? What's the status of it? I didn't get the determination letter, can you send it to me? So all of that is maintained inside the Qualitrac system. So we'll get into kind of the nuts and bolts here of submitting an SDMI waiver request. So beginning March 2nd, and the reason why it's March 2nd is because Telligin does all of their system updates they do every other Tuesday, and therefore they will be doing some updates for this work next Tuesday evening on March 1st, and therefore it will be in the system and ready to go by March 2nd. So that is why we are starting on March 2nd. You guys will be able to start submitting the SDMI waiver prior authorization request to us through the Qualitrac system, which is our provider portal. The requests that will be coming to us are the environmental accessibility adaptations, medical supplies, or specialized medical equipment that is over $500. A training that was held last week is for that second bullet, where providers must complete an online registration process, and Clayton has already worked on that, so we are good to go there. Once he gets you guys set up with a username, you will get that information. So you'll get that username as well as instructions on how to create the unique password. This is our portal page bookmark, and this is the page that we will ask that you bookmark and access the portal from, so that you don't run into any issues. And that page takes you to this screen. So this is a screenshot of what that portal page looks like. And again, at the end of this, I will show you that. You can see here we have a lot of different information on here. Under the document library, there's different forms and things, not necessarily that are pertinent to your piece of review, but other areas that use it. So it's just a good place to look. Once we're done with this training, we will be posting it under the education and training section along with the slide deck so that you can have it to refer back to if you do ever have any questions. So to get started, when you go to the portal page here, you will click on the portal sign-in button that's kind of a orangish reddish color up in the top right-hand corner. And this is what will take you into Qualitrac. And so when you click on that button, you get the sign-in page. You'll enter in the username that you were assigned along with the password that you established, and then you will click the sign-in button to access the system. There is a reset password link at the bottom there. So if for whatever reason you forget your password or you're having issues, you can always reset it yourself so you don't have to have somebody else do it. One thing to keep in mind is if you try to log in, you think you know your password and you get it wrong and you keep trying and trying and trying. After so many tries, it will lock you out, and then you'll get a message that says you can't update your password at this time. If you wait, it's 15 to 20 minutes, the system will reset itself and unlock, and then you can try again. So just keep that in mind if you're like, I thought I knew what my password was, but if you keep putting in the wrong password, it will lock it for about 15 to 20 minutes and you won't be able to change it. We do ask that you not bookmark this page because there's a lot of security built around this login page. And while it may work the first time you log in, the next time or the next time it won't. So again, we really encourage you to bookmark our portal web page and just use that portal sign-in button every time you need to go in there. So if you do need to reset your password, when you click on that link, it'll take you to the reset password modal, and you will enter in your username, not your email address, your username. So when you put in your username and click the next button, what it's going to do is the system is going to go find the email address that is associated with your user ID, and then it will send an email to that email. So just keeping in mind here, you put your username in there, not your email address. Okay, so you've now logged in, you put in your username and password, and this is the landing page that you will come to. We call this the dashboard. And so from here, there's different things we'll go over in the next slide, some of these navigation tools that are up here. You can see the screen is split into two sections, utilization management and care management. We at Mountain Pacific only use the utilization management piece of Telligence portal. So we focus on the utilization management side of it. If you inadvertently click a button underneath the care management, it is set up so it still takes you to the utilization management section. So you can never get into the wrong place. So you don't have to worry about that. Some of the menu bar here. So this menu bar is available to you wherever you are in the system. So the Qualitrac logo, if you're ever like, gosh, I just want to kind of start from scratch, I'm not really sure where I'm at, you can click on the Qualitrac logo and it'll take you back to that landing page that was on the previous slide. The little magnifying glass, that will open up search options for you. So you can either search by a case number, if you've already started a case, or you can search by a specific member. The next little one that's kind of like 3 lines, that is the task queue. This is where you would go if there were any assigned tasks for you. For example, if there was like a request for information. So if you submit a case to us for review and we need more information from you, we would send a request for information back to you. And that's where then you can either click on those 3 lines there, or you'll see on the next slide, there's a start task button. The little question mark is a knowledge center. There's different provider user guides, frequently asked questions, and tip sheets. That is managed by Telligent because, again, this is their portal. And so there's just some good information in there if you were ever looking for anything. Our recordings, as I said, will be on our portal page. It won't be in this knowledge center. And then the last one is the one that looks like a little person in the bubble. And this icon will allow you to view and manage your own profile. So here, let's say your phone number changed or your email address needs to be updated. You can go in there and update that information. The only thing you cannot update is your username. Once a username has been established, that cannot be changed. So again, on that landing page, on that right-hand side was the utilization management screen. And from here, there's 2 different options. You have the start tasks and the search. The start tasks, again, will take you to that task queue if something has been assigned to you, such as a request for information. The search button will allow you to search for a member or a case, just like the magnifying glass did from the previous slide. So if you want to find a member, of course, this is kind of the crux of what you're needing to be in here for. You're needing to submit a request for somebody. So you will click on the search button, and then this will start your ability to start the review. So when you go to find a member, you have 2 ways to search for that member in the system. You can either enter in their member ID and date of birth, or you would enter in their first name, last name, and date of birth. So you can do it either way. If you're doing it by member ID and date of birth, it has to match exactly what is in our system, which is what we receive on the eligibility files from Conduent. So if you put a member ID and a date of birth in there and you don't get anything back, then that would tell me that either the person really is not on Medicaid, but in this situation for you guys, they all will be on Medicaid. So then really what that tells me is that something is wrong. Either the date of birth is wrong or the member ID is wrong. So then the other option is to search by their name and their date of birth. Again, it has to match what's in the system. So in this example, we have in there Alex Smith. Well, if the name is Alexandria or Alexander, it won't match. It has to be exact. So you can't just put in a partial name. So if somebody's name is James, you can't put in Jim or Jimmy or something like that. So again, just making sure that you're putting in that correct information. Once you do put that information in and you do a search, this is the screen that will show up. It'll show you any matches that were made. And so then at this screen, any of the data fields that are in blue are clickable links. So you can click any one of those, whether it's the member ID, you can click on their name, the date of birth, or even over here where it says their gender. Clicking any one of those is going to take you to the exact same place, which is the member hub. And so once you're in the member hub, then this is kind of where everything is organized. So this is where you're going to be able to see any requests that have already been submitted by your organization on this member. So we internally, of course, can see everything that is associated with that member. Maybe they were admitted to a hospital out of state somewhere. Maybe they had a durable medical equipment, request. We can see all of those. You will only be able to see anything that your organization submitted. And so on here, I'll go back real quick here. So up here, you can see just some basic information about the member. And this is all dummy information from their test site. So there's no PHI on here. But over here is this view member details button. So if you click on that, it will expand that a little bit further, and anything we receive on the eligibility file will be located here. So if there is a phone number, you would be able to see it. If there's a mailing address, you would be able to see it. But again, this is what comes to us on the eligibility file. So if you were to see something on here and go, oh no, that's not their address, we cannot change it in the system. It would have to go through OPA, and once it got updated at OPA, eligibility files get updated, and then it would get sent to us. So just keep in mind, if you do see something in the demographics that isn't correct, that means that the member hasn't updated it with OPA yet. When you, after you're done looking in here, there's this view even more member details down at the bottom. And so if you click on that, it'll expand even more, and then you would be able to see their eligibility span, like their deprivation code, some things like that. And then once you're done and you're ready to kind of close that back up, you can just click that view member detail button again, and it will minimize it. So again, as I said, this will show any that are previously submitted. This was a screenshot that was from a previous training that we did. So that's why the review type says physician administered drugs. Normally you would not see that, but I was stealing some screenshots when I put this together. So you've logged in, you've searched for the member, and now you're ready to add your request. So over here on the right-hand side is an add button, and then you will click that add button to start the request. What you will see in Qualitrac is the way it is set up, we call it panels. So each of these, they kind of have a green header. And so each one we go through we will call it like a panel. So this first one is the authorization request panel. And when you log in here, the date and time will be defaulted for you. So you don't have to fill that in. And then the next step is going into the review type. So when you select the review type, there will be an option of SDMI Waiver. And so you will select that. As you can see here, these are all the other areas that we do reviews for that go through the Qualitrac system. So you will select SDMI Waiver. And once you select that, the place of service will automatically default to community and or home. So you don't have to do anything with that. It automatically fills it in for you. And then the type of service is where you're going to select what is it that you're submitting to us. Is it an EAA? Is it a medical supply? Or is it a specialized medical equipment? So you have the three options there. Let's say you need to submit a request for both a medical supply and a specialized medical equipment. You would need to submit two separate requests and label one as a medical supply and label the other one as a specialized medical equipment. And then once you select whatever the type of services that it is that you're submitting, the last one is just the timing. Excuse me. And the timing is a little bit more, there's more options for other types of work, but for SDMI waiver requests, you will always select prospective because these require prior authorization. That prior authorization needs to be completed before the service is rendered. Therefore, it's prospective, meaning it's in the future. So then once you fill that in, that panel will be done. And at that point, you're going to click the green Add a New Request button. If you get to this point and you realize, oh goodness, I picked the wrong type of service, or oh goodness, I'm on the complete wrong person, you can hit the cancel button and go out of it, and it doesn't do anything. By hitting the Add New Request button, what it's going to do, it's going to refresh the page, and then based on what information is in here, the review type and the type of service, is going to then create the rest of the panels that need to be filled out. So once that page refreshes, the next panel will be a dates of service panel. So your start date is going to be the current date, whatever date it is that you're submitting the request. And then your end date is going to be 1 year from your current date, because the PAs are good for 1 year. The next panel will be the coverage panel. And this displays information about the member's coverage and eligibility. And so again, this is pulling from that eligibility file and information we get. So if that eligibility file indicates that they have Medicare, then that would be indicated down here, and it would tell us what kind of Medicare. Is it type A, type B, or part A, part B? If there's an indication that there's a third-party liability, that will be there. So these are all filled in. These are not, you do not need to do anything with these. They will be filled in for you. And again, come from that eligibility file information. Sometimes what you will see in this panel is this banner here that says member not eligible. And what happens with that sometimes is, say, for example, in this screenshot, the person has Medicare, and so the eligibility is thinking, well, Medicare is prime, so no, they're not eligible. So it's not a big deal, but this is what kind of stumbles people sometimes, is when you get here, if you see that panel and you have confirmed that, yes, they have current Medicaid, all you have to do is put a comment in this eligibility comment box here. Doesn't have to be elaborate. It can just be as simple as current Medicaid, has current Medicaid. I mean, just very simple. And by putting a comment in that box, it will allow you to move on. If you don't put a comment in that box and you try to move on, you're going to get an error message in the portal. Again, this is built around some other work that we do where we may or may not have to do a review depending on the other coverage that a person has. So it does just say in that box there that the member appears to either not meet eligibility requirements or has multiple coverage plans. We cannot confirm eligibility for the entire span of care. Please provide rationale for continuing with this request. Also, what you're going to see is, because we only see Medicaid eligibility month by month, because you're putting that end date in the future, you may see this on every person you put in, because it can't verify that they have eligibility in future months. So that would be why this would pop up in this case. If it were a case where we were just putting in the dates for this month, then that box would not show up. But again, the simple takeaway, just a very simple comment in here that says current Medicaid, and it will allow you to move to the next one. The next panel is the personal representative panel. This is not something that we need for the SDMI review type. Again, this was built for a different line of work, so you're able to just skip this and you don't have to complete it. And you'll notice here, there is no red asterisk, which means it's not required. You'll see here, there is a red asterisk, and that means it's required. So the next panel is the providers panel. This is where you are going to enter in who is the treating facility, and the ordering provider. In your guys' case, what we're going to have you do to keep it simple, the treating facility will always be aware, and then the ordering provider is always going to be the member's healthcare professional that has wrote the prescription for the item that you are requesting. Again, we know that aware is not necessarily billing for these services, but because we won't always know who is billing for them, for simplicity's sake, we're going to have you put aware in here. It doesn't transmit anywhere, so it was just the easiest to be able to do. So in this panel on the right-hand side, there's an add button. And when you click the add button, it's going to take you to another screen that will allow you to then search for that provider to enter in the information. So this is the screen that will come up, the search screen. What I would encourage here is less is more. We have found that if you try to fill in all of these boxes for whatever reason, you're not going to find anybody, even if you have all the information correct. So typically what I tell people when they're putting in a review, if they know the NPI number, use the NPI number. In this case, I pulled Aware's NPI number, I typed in Aware as the organization name, and then I selected state of Montana. So I did 3 boxes, but again, if you're putting in just your NPI number, that's all you would need to put in there. You'll click on the blue search button, and then by putting that in there, you can see that it pulled back a lot of matches. And so over here on the right-hand side, this all came from our provider file that we received. So your NPI number is associated to multiple different provider ID numbers as well, which you can see under this primary number. So what I did is I just used this Aware Incorporated case management one. Again, it really doesn't matter which one you select here, whether you just select the general Aware or the case management one. I selected this one as I was doing the slides for the presentation today. So, and again, all of this information is what is on the eligibility file. So we don't have any control over changing that information. So once you decide which one you're going to select, you'll click on the green plus button here, and then that is going to take you back to this screen and add it to the case. And so now you can see that Aware is listed as the treating provider. So for the ordering provider, there is an option to copy, because in some cases, the ordering provider is also the treating provider in other areas that we do reviews for. But for SDMI waiver reviews, those should never be the same, because again, you should have an ordering provider, whoever wrote that prescription, and then you guys as the treating provider. So then you will just repeat those same steps, click on the add button, search for the ordering provider, and add them to the panel. Once you have them added, then you have this ellipsis over here. So let's say you put somebody on there and you went, oh, that's the wrong doctor. There will be the option to delete it, and then you would have the add button again and you could start over. So the next panel is the provider organization visibility panel. And this one is a really important panel here. It will be a drop down, and your only option is going to say Aware. And what this does is this then allows anybody who has access to Aware, that is a registered user, can see any request that anybody else submitted. And so if you don't select this drop down and you leave it blank, then only the person who submitted the request will be able to see it in the system. Nobody else will. So it is really important. I was not able, because I was in the test system, I was not able to have you guys listed as the provider organization. So that's why it says somebody completely different here. Again, these were, you know, snippets that we took from our stage environment, but you will only have the option of aware. So just making sure you select that from the drop down. When you get to the diagnosis panel, same thing, as you're probably starting to see a pattern. There's the add button. When you click on the add button, it will take you to a screen to be able to add a diagnosis to this panel. For diagnoses, you can search by either code or by term. Code would be if you know the specific ICD-10 code. Term is, well, I don't know what the code is, but this is what I think they have, kind of a thing. If you search by term, it's a little bit more difficult because, you know, I did this yesterday. I typed in depression and it didn't pull anything back. And so I was like, well, that's weird. But then when you type in the code, it pulls it up. And so it's just, the term is not as user friendly. So if you know the ICD-10 code, that is the better way to be able to search. So you'll type it in the box, hit the blue search button, and then any, you know, whatever it hits upon. So if you search the code, of course, it's going to pull back the code that matches. If you search by a term, it may pull back a list of different diagnoses that you would then have to select from that you're going to choose. And then to select it, you just click the radio button at the front, and then you can click submit. If you have more than one diagnosis, you can do the submit and add another button. And what it'll do is it keeps you in this screen. So it'll attach that one to the case, and then it'll let you search for another diagnosis. Submit is, I'm just putting one diagnosis in there. I don't need to put any more, or they don't have any other than just the one. So you have both options there. If you accidentally hit submit and you're back out at the main screen and you are like, dang it, I needed to add another one, you will just then click on the add button again, and it'll take you back into that screen. So it's, you know, you're not out anything if you accidentally do that. If you do enter more than one diagnosis, you do have the ability to drag and drop them. Again, probably not as pertinent to the type of review that we're doing for SDMI waiver. But in this example, if we wanted line 2, you could click and hold it and actually slide it up, and it would then change it to show that line 2 is the number 1 kind of primary, and then this would move down to the bottom. The other option you have, oops, sorry, didn't mean to click on that. The other option you have is there's this red garbage can. So if you add a diagnosis and it's wrong, you can click the garbage can and it'll delete it, and then you can re-add the correct one. And you'll notice that's in these panels as well. And the previous ones, that like the provider that we talked about, you can always delete. The next panel is the procedure panel. The way that we programmed this is that based on the type of service that you picked in the first panel, that authorization panel is going to default this procedure panel for you. So you don't have to go and search by the code and add it or do any of that. So it will be defaulted. So in the example that I had done, I had selected medical supplies. So then by the time I got to the procedure panel, this was already in here, the code. And these are the codes that we were given by the state. And so we ask that you not add another code or delete this code. What you do have to do is edit. So right here, you see this little blue, it looks like a pen. That is the edit button. And that is where you will need to be able to specify how many units is it that you are needing for that year. If that's, you know, if we're talking about a medical supply and you need a certain number of units, and what that total cost is going to be. So in this example, I said if one case of supplies is 1 unit and you need a year's worth, then you would enter in 12 down here in this units box. and then you would enter in whatever that total cost is. The rest of these fields, just leave them blank. You don't need to do anything with that. So once you enter in the units and the total cost, you will click the green update button, and then it just minimizes this. And then you would notice up here, this quantity would be updated, and then there would be a cost showing there as well. The documentation panel. So this is where you will upload any of the related documentation necessary for the review to be processed. You will not be able to submit the request to us if you do not attach documentation. So there has to be something attached. Just as in the paper process, we are asking that you still complete that form, because there are some questions on there that we're not able to capture in these panels. And so the form that you used to fill out and send to the state, you would still fill that out and attach it here. And then any additional information that you would have to support that request, you would attach it here as well. So again, we click the orange add button, and then it's going to pull up the documentation upload modal. And so from here, you can either drag and drop a file in there from your desktop, or you can say, do the click here button. It'll open up a Windows directory, and you can go find where you saved the file on your computer and then attach it. Documents must be in PDF or Word format. The file name cannot contain any special characters. So if you saved the file name as last name, comma, first name, it will not let you upload it because of the comma. So you just keep that in mind when you're naming it and saving it. Make sure there's no special characters in there. Once you upload it, then it'll show that like right here, it'll show that the file is uploaded, and it'll default the name to whatever the file name is. You can change that name, but it doesn't change the fact that if there's a special character in the original file, it still won't let you upload it. And you would get an error message letting you know that it can't attach it. So once you upload it, so this is where you'll see the name and it populates into here. Then the next one is the category. And again, this is just kind of what is the type of document that you're attaching. There's a drop-down list. Most always it'll be clinical. But again, just pick whatever the most, pertinent one is. It's not life or death. We don't really look at that. It's just a feature that was built into the Qualitrac system. So if you pick clinical, then it will come down with another one. It'll pop up topic. That then further defines what type of clinical information are you attaching. Is it a medical and treatment history? Is it a history and physical? Things like that. So once those couple of things are filled in, you'll click the upload button. It will then attach it to the case, and you can repeat that step as many times as you need. So if you have 5 separate documents that you need to upload, you would go through that process 5 times to attach it to the case. And then this is what it would look like. So under this documentation tab, you would then see what it was you attached. And then the name is a clickable link. So you can click that name and it will then open the document that you attach. So if you wanted to just verify, okay, I just want to make sure that I attached the right thing, you can click on it after you've attached it and go, yep, that's what I needed. Again, if it's the wrong one, you realize it's for the wrong member, whatever the situation might be, you have the trash cans here that you can delete. Once that is done, you're almost there. You're going to hit the continue button. It's going to kick you out to a screen for MCG guidelines. Again, this is a required piece for certain reviews that we do. It does not apply to SDMI waiver requests. So when it kicks you out to here, you won't actually have this document clinical. It won't be highlighted. The submit request will be highlighted. And so you just click the submit request button. It's going to kick you back into the Qualitrac system. And then you're at the last step of the attestation. And this is just to certify that all of the information that you have submitted is accurate and complete. You read all of that, and then you're going to type in your username again, not email address, username. Once you put in your username, you're going to hit the green submit button. It's going to pop up a comments box. If you wanted to put a comment in there, whatever it might be, you wanted to send a note to the reviewer, you could certainly put that in here. It is not a required field. It is optional, so you don't have to put anything in there. And then you'll want to click submit again, whether you put a comment in there or not. So you're going to hit submit twice. Once you do that, it's going to refresh and it's going to take you back to kind of a summary page where you are then able to scroll through all of those panels that you just completed and make sure that everything is correct. If for some reason you do find that you have something in error and you need to fix it, you can click on the blue actions button and select edit, and it'll reopen it and you can go back to whatever section it is you need to fix and fix it. You would also have the option to delete it at this point. If for some reason you got all the way through all of that and realized, wow, that was the wrong person, you can delete it. As long as we have not started the review yet, you will still have that ability to be able to delete it. So that is submitting a request kind of in a nutshell. And I know it sounds like a lot as I go through it just because of there's a lot of panels there, but I promise you, once you get in there and you get the hang of it, it's like a 5-minute thing. It does not take very long. You get very used to what those panels are and clicking, you know, those buttons, and it becomes kind of habit and second nature. So some of the other abilities that you have of viewing the request status and the outcomes. One thing that we really like about Qualitrac is that it puts out email notifications. And so the user that enters the case, so if I'm entering a case for Aware, I am going to be the one who gets these email notifications, not everybody. So it's just the person that enters it. Everybody can see the case if they log into Qualitrac, but only the person that actually enters it will get these email notifications. And you'll primarily get an email notification. So as soon as you submit that review request into the portal, within a few minutes, you will get a confirmation email that says, hey, your request has been submitted. Here is your case ID number. And, you know, you can check back in if you want to, but you will know that it was submitted. You will also get an email if you start a review request, but you don't actually submit it. So this does happen sometimes. People will start a request, they think they get all the way through it, or maybe they get a call, they get distracted, they forget that they were doing that, whatever the situation might be. If you get through part of it, if you don't go through all of the steps of getting it submitted to us, you will get an email every day after that until you complete it. So you will get an email that says, it looks like you started a case, but it doesn't look like you've submitted it. And it will give you instructions on if you need to log in and finish it, here's what you need to do. If you've decided you no longer need to submit this request, here's what you need to do. It'll tell you how to log in and delete the request. If you do nothing, you will continue to get those emails every single day. So we have had people call and say, I keep getting this email, like, I don't know why. And it says right in the email, you haven't submitted it correctly. If additional information is requested, like I said, we get it. We need something else from you. We will send an RFI, which is a request for information, back to you, and then you will see that here, or you'll get an email notification. Once the review is completed and an outcome has been rendered, you will get a final email notification letting you know that an outcome has been rendered and you can log in and access that. So once that review has been submitted, you can find that review by either going back to the magnifying glass and doing a member search or a case search. So if you're doing a case search, you would simply put in the case ID number and hit search, and then it will pull back what it found for you. And again, these blue links, you can click on them and it will take you directly into that specific review. And then you'll be able to see what the status of it is. If you do a member search, so back to like you did before when you first started the case, and you did either Medicaid ID and date of birth or last name, first name, date of birth, it will then take you into the member hub, which again is that first landing page that we showed you. And so if you are in the if you land in the member hub because you searched their name, then over here on the right-hand side under action, there are these 3 dots, which are an ellipsis. When you click on that, it will expand and give you some options here. So in this case, because our reviewers had not started this case, the delete option was still available. If we had started the review, you would not see that delete option anymore. But if you then to get into the case, you would click on view request and it will take you into that case. So it takes a couple more steps if you're searching by their name to get back into the case versus if you have the case ID and you just search the case ID. I will go back here real quick. So when you are, if you pick case, the magnifying glass and say case search, this is where it takes you to. And you can see here that there's this case search box. And then there's these different ways to search. So it will default to the top one, which is case ID. And so then that's what you would search by because that's what you would have at that point. Because if you don't have an outcome yet, you're not going to have an authorization number. The claim number, we don't use that. And so I'm not even familiar what that claim number is. We don't use it in any of our reviews. So that would be null and void for you guys as well. Okay, so I've mentioned request for information. So again, if we determine we need more information before we can proceed, then you will get an email asking for more information. And so there's 2 ways for you to access that scheduled task queue. So you'll get the email letting you know that we need something else from you. You're going to log into Qualitrac. And then either from the navigation bar at top, you'll click on the 3 lines, or on the dashboard landing, you'll click the Start Task button. That's going to take you to the task queue, and you will see the person's name there, and you will see that it says Request for Information. And so a helpful little tip is that you can click this blue bubble, this little message bubble, and it will show you what it is we need. It will show you what note the reviewer has sent back to you. So you don't have to start the task to see it. You can see it from there. The other way is to click on this blue ellipsis right here on the left, and you'll have the option, it'll say Start Task. And so when you click that, it will then take you into the case. You would scroll all the way down to the bottom and there will be a new panel that says correspondence. And this is where we will attach any correspondence or letters that we are communicating with you. So you can either click on the blue message bubble and see what it is we need before you start the task, or you can start the task, scroll down and click the link and read there for what it is that we're needing. So you've read the note, you know what we need, you gather that information, and now you're ready to submit it to us. If you haven't started the task, you will go back to your Start Task page, click the ellipsis and start it. So here you would click this and start it if you hadn't started it already. If you already started it and then went out of it, when you click on this ellipsis, instead of start, it'll say resume. So you have to go through this step, because if you just attach documentation without going through this step, it won't send it back to us. So anytime there's a request for information, you want to go to this task queue and make sure that you're clicking on the ellipsis and starting the task. And once you do that, you will scroll back down to the documentation panel, go through those same steps of attaching documentation that we requested, and then it will send it back to us. So once you attach it, you'll scroll back to the bottom of the page, click the done button, and it will kick that back to us. You don't have to do anything else. After you click the done button, it's going to take you back out to that scheduled task queue, and you will see that that task is gone because you've completed it, and now it's back in our hands and waiting for us to review it. The big thing here is that we ask that you please do not start a new review request, because it's more time for you to have to re-enter everything. It delays the review process because now we have 2 cases pending on the person and we have to figure out what's going on. So we really strongly ask people that if there is an RFI, you have to go through those steps. Refer back to this slide deck, call our call center, whatever you need. If you need help to, how do I get this back to you guys? Just please don't start a new one. And then viewing the outcome, again, whether you log in through searching by the member name or the case ID, you'll get to the same member hub and you can say view request, or if you search by the case, it'll take you directly in there. And then you'll be able to scroll down and there will be a panel called the outcomes panel. And you'll be able to see over here on the right that it tells you what that outcome is. And then this is kind of a dark brown color when you're in there. You will click on this, and by clicking on that, it expands it. You'll see on the left-hand side, this shows you what you entered and what you requested. And then on the right-hand side is the final outcome. Was it approved? You know, did we change the dates at all? What amount of units did we actually approve? What total cost did we actually approve? So this will be what we actually approved. So sometimes this does not match what this shows. And that's just based on how the outcome or the review proceeds. And then, as I mentioned, you can print any of these letters out of the correspondence section. So last time we were in the correspondence section, it was for a request for information. This time you see that there is this approval provider medical necessity letter that you would be able to click. It would open up that letter and then you can print it, save it, whatever you need to do with it. If you need a copy to put into the members file. But all of the information that was in that outcomes panel will be in that letter that you'll be able to get there. So that is entering it in a nutshell. I know we are coming up on the 3 o'clock hour, so I understand if you need to jump off. I will pull up the portal page and walk through that real quick, just so that we have that as part of the training. And then for anybody who needs to jump off, you'll be able to go back and refer to that. And then at that point, after I run through that real quick, we can see if there's any questions. So again, this is the website that we ask you to bookmark so that you always start from here. And then this is our call center. So if you ever have any questions or you're confused or whatever it might be, please don't hesitate to reach out to us because we are more than happy to help you with that. Okay, so I am working in the stage environment. So this is our test system. So when you click on the portal sign-in button, you will come to the sign-in page. And this is what'll happen, but you'll be in the actual system, and this looks identical to the actual production database. So here's the dashboard. We're gonna start by searching for a member. So I'm gonna do a search, and so that is one thing. So if you're on the dashboard, up here, you can specify if you want to search by the member or search by the case. Down here, if you select search, it's just going to bring you to this general page. So you can either search by the case here, or you can click on the member search button. So either way, you're able to get that. So let me pull up, I saved some information here so that I could do this fairly quickly. Okay. So this is again, fake information. So no PHI here. So I did the member search. It found somebody. So now I'm going to click on one of the links. It's taken me to the member hub. You can see here, so I was already doing this as I was working on putting the PowerPoint together. So you can see what it would be in here that is attached to your case. And so if you go in here, you would want to double check, make sure nobody else has submitted what you're getting ready to submit. And then you come up here and here's the add button. So now we're going to start the entry of the request. And so we picked the SDMI waiver. It filled this in for us, and we're going to pick specialized medical equipment. And again, it's always prospective, and we're going to add that new request. And now, based on what I just entered, it's creating the rest of the case for me. Okay, so here's the dates of service. So you can either type it in or you can use the calendar. The calendar is easy for the current date. For this one, then it takes a little bit if you want to click forward or just type it in. So I've got my dates of service in there. So here is that banner that showed up. Again, this is the test system, so there's no real actual data in here. So that's why this is pulling up. So I'm just going to put a note in here and it lets me move on. We don't need to do the personal representative. I'm going to add the treating provider. So I clicked the add button. And again, this is where you put in just your NPI number. And I just hit the enter key. So you can either hit enter or click on the search button. Again, it pulled up all of the matches that it found based on what I entered. So I'm going to go ahead and add this one. I want to click the green button. It's going to take me back out to the main page, and you'll see then once it reloads here, and it takes just a second, that aware will be added. So I've got aware in there. Now the ordering provider, again, when I click add, now it's going to say, do you want to add or copy? We always want to add. And then here you're going to put in whoever that ordering provider is. If you don't know their NPI number, I would suggest just last name and then Montana under state. That seems to be what works best for me. I pick on our medical director, so I always use Dr. Kunzweiler. So again, you click the green button. It's going to add it. And when you scroll down, now you see both of them are in here. The one thing here is, so what I'm not able to do, normally what you will see is there will be that drop down box here that you will click on and select aware. Because again, it's test, I'm not affiliated with your organization. I can't select it, but you will see a drop down in this panel that you will pick. Diagnosis, same thing. Hope you're seeing a pattern. We're clicking the add button. So here we're going to do a code. Again, I just hit the enter button. It pulled it up. So I'm going to select the radio button and I'm just going to submit that one. If I wanted to submit and add another, I could. But again, now if I forgot and I wanted to, I can click on add. Here's the procedure. So it's already defaulted. I don't have to do anything with this code. I'm not going to add another code, but I am going to edit this code. So I clicked the edit button. I'm going to modify the number of units that we need here. And then I'm going to put in the total cost of whatever it is. And then I'm going to update. And now it minimized that back. You see it's still the same code. The quantity updated and the total cost updated. Last step is the documentation. So when I add that, I have a sample one. So I'm just dragging and dropping. And then again, if you click here, then it'll expand and it'll let you come in and pick what you need. So I'm attaching it. Now I have to pick the category. So here, this is where I would, this is a clinical, I'm going to say. And then this is a case note. So again, doesn't have to be exact. I'm uploading that. Now you can see here, it is attached. So if I wanted to look at it, I can click on it and it downloaded. And so if I click on that to look at it, this is all it is. So I go, yep, that's the right document. I want that attached. It's good to go. I'm going to continue. And now this is where it's going to kick us out to the MCG. And again, we use that for other areas of work. So it takes a minute. And when you get here, so right now I can't click this. As I was doing this yesterday, I realized there's one more thing behind the scenes I need to do. But normally you will click this submit request button. I'm just going to hit the back button because it'll do the same thing right now. But normally you just hit that, the submit request. And when you do that, it takes you back into the screen. Here is the attestation. So you're going to enter in your username and say submit. Here is where you can put a note in if you want. You don't have to, but you do have to hit submit again. If you hit cancel, it will not submit the request. So I'm going to hit submit. This is when the page refreshes and you will see the summary page. And here is where then you can scroll down and just double check and go, yep, it looks like everything is correct. Let's say here you realize you forgot you had this year's date. That's where you can come up here and say edit and it would reopen all of those. And so you'll notice now that you don't have the add button for all these panels except the documentation panel. You can still attach documentation at this point, but if you needed to change other things, you would need to edit the case first. And then here's that outcomes panel. So if I click on that, it minimizes. If I click on it, it expands. So because it hasn't been reviewed yet, you just see the requested. Once it's done, then you'll see that's kind of split screen like I showed you before. And then there are no correspondence letters yet because we haven't completed it. So at this point, you're done. You've looked it over. You're like, yep, I'm good. This is where it's a little weird is it doesn't really give you like a done button, but you know that this is your summary page. You've already submitted it. So if you're done and you don't need to enter in another person, you can just come up here and log out. Or if you do need to enter another person, then you can come up here and say, okay, I'm going to go back to the member search and enter in the next person that I need to enter. So that is a very quick down and dirty of entering it in there. Are there any questions that I can try to enter or ask for you, answer for you at this point?
I don't have any. Does any of the rest of the team have any questions? I actually have one question. I'm Mishi and I'm a case manager for Region 10 and 1. You mentioned a case ID that we can put in as well. Is that automatically generated?
Yes, that is. Thank you. I should have shown you that. Let me pull that up really quick here and I'll go back and show you where that was. So one other thing just to know as I'm getting to that to show you, there is this cases tab, and this cases tab is any current cases for your organization. So you can come in here and click on it and see what all has been submitted here. And then you can filter it. Do you want to just see the last 90 days? Do you want to see all of last year? And then if you want to clear it. So again, because I was messing around in here. So this is the one that we just created. And so when it refreshed and it came to the back to the summary page, it's right here. This is your case ID. And that's what will also be emailed to you. And so actually, I probably have an email. So here is the email that I received. Because I submitted that. So this is the email that said, thank you for submitting your request. This is to confirm that it has been received. And here is the case ID. So you also get it in the email that gets sent to you. Great question. Anything else?
I don't believe so.
Okay.
Well, I have one. I think I just missed.
Sure.
My phone went off. So is that the PA number then that it auto generates, or the request ID?
No. So the PA number will actually be down here. So in the outcomes panel, it says authorization number. So it will be located here as soon as an outcome is rendered. And then it will also be on that letter. And I should have created a letter, but of course I did not. Let me go see. I've got one on this other case that I was messing around with yesterday. Just to kind of show you what that letter would look like. Okay, I did, yay. Okay, so this is what the letter will look like that comes back to you guys. So this first section is what you requested. So just the general, their name, date of birth, Medicaid ID, and then here's that case number specific to Qualitrac. Here is what you requested. And then this is what the determination actually was. So you'll see the dates of services that were approved, the number of units that were approved, and the authorization number. And then of course it'll show you the procedure code that was attached, and then any, rationale or notes that we had put on there. Anything else? And again, don't hesitate to reach back out to us. If you do have questions, calling our call center, we are happy to help people through it. And it is the first couple times you do it, it might feel like, oh my goodness, this is taking me forever. It should never take you like an hour or all day. And we do get some people that will call and be like, I have spent hours on this. And I'm like, oh, please don't do that. Call us before you spend that much time on it. And as you saw, like it's pretty, duplicative. Like you kind of do the exact same thing in each panel. And then once you get the hang of it, it is a quick process. But don't hesitate to reach out and let us know if you have questions. All right. Well, thank you guys so much for joining us. Like I said, I will get these posted to our website, and I will let Clayton know as soon as those are posted there.
Okay.
And if you have any questions, let us know.
All right. Sounds great. Thanks, Jennifer.
All right, you bet. Thank you.
All right. Bye.
Bye-bye.